Okay. Hello, everyone. Thank you for joining us. And we're going to do a webinar here discussing the emerging trends now because it's very hot in social media and all the news on PDRN and exosomes. And you're all wondering what kind of PDRN should one be using and what kind of exosomes and when should I use them and how can I combine them? So I speak for various companies. There are some of my disclosures, including this current company, Induction Therapies, as well. I've had an interest in PDRN and exosomes, and most of this stuff, as you all probably know, emerged from South Korea. And my practice is in Vancouver, and it's a quick 11-hour flight over to Seoul, Korea. And I've literally gone almost every single year for the past few years just to see what the Koreans are up to. So I'm well versed in these things. And unlike us, they are far more innovative. And they even have clinics there, like go back 20 years. I mean, you wouldn't believe the ideas you get walking around Seoul, Korea. And the other thing I found there is that they even have one of the leading plastic surgery clinics is named after me, the Braun Plastic Surgery Clinic. So these are apparently surgeons that from another mother, I guess, that must be my half brothers or something. But there is truly the Braun Plastic Surgery Clinic in Seoul, Korea. And there are their cards. As you can see, I'm not making this stuff up. And they have almost 2 million subscribers on YouTube. This is a major force. And they use exosomes and PDRN as well. And the Koreans now are apparently even coming to the United States. As you can see here, anyone in the Los Angeles area can go see the Braun Plastic Surgery Korean people coming to LA, I guess, to solicit medical tourism over to Korea. I'm very interested in this kind of thing because we have many people in Vancouver that specifically go to Korea for 1 or 2 day treatments and then recover in the hotel over there. This is a real thing. And, plane loads of patients are going over there, and I'm trying to tell them that I can do this same stuff over here in Vancouver. You don't have to travel. The Koreans are very advanced, and this is very familiar to them, the regenerative medicine field. I was at the RAES, Regenerative Aesthetic Exosome Summit in Seoul, Korea, last year, and that was the 10th annual exosome summit. There you can see the exosome bottles in one of the clinics that they brag about how many exosomes they use. And I was fortunate enough to be a speaker there, which was very nice at the RAISE Summit. And I've also spoken on exosomes at IMCAS in Paris. And you even have clinics. This is one of the fellows I visited there. He calls his clinic the Global Exosome Center. So there's all kinds of private and government partnerships, private entrepreneurs such as this doctor with other corporate entities, like including Samsung and Exoco Bio. So this is why they get ahead there. They all work together to further the field. And PDRN and exosomes have, of course, spread from Asia. These are two little images from websites from India. And in India, they are using PDRN and exosomes for skin rejuvenation as well. And they even advertise it on their websites. So why all this hype about PDRN and what is PDRN? Well, it all stemmed from Kim Kardashian, I suppose, over here in the United States, when she said, I got a salmon sperm facial. The PDRN she got was derived from the sperm from salmon, and she had this, she says, injected into her face. So it's not clear to me whether it was a point injection or done with microneedling, but of course it spread because the Kardashians are famous, especially for being famous, and it was featured in Vogue magazine, even in the Saudi Arabian edition over in the Middle East. And then, of course, it made real self, where they talk about the trending injectables, including salmon sperm, the salmon PDRN. And then other celebrities hopped on the bandwagon, as you can see here. But it's very interesting. The Beverly Hills dermatologist Harold Lancer said, watch about cheap knockoffs made out of crappy trout. So I thought that was quite good as well. So you want to know where your sperm is coming from before you put it on your face. So what is PDRN? And it's actually very simple. Deoxyribonucleotide is DNA. And, DNA is made up of purines and pyrimidines, as most of you will remember from biology. We have four different nucleosides. And polydeoxyribonucleotide, PDRN, is simply strands of DNA that are derived and purified from the sperm from salmon or chum salmon. So they have salmon trout and chum salmon. And why do they do these DNA fragments from salmon? Because the salmon spermatozoa are very similar to human spermatozoa, and they provide highly purified DNA without excipient proteins and peptides and other products that you might get from other tissue. So it makes salmon sperm ideal to lessen any immune reactions. And in the couple years now that I've been using PDRN from salmon, I've yet to encounter a single reaction on a patient. So, where did this stuff initially come from? Well, it's well over 10 years old. PDRN was pioneered by the Koreans as well. And throughout the world now, there are various papers have been done on wound healing. And here, for example, is a paper from 2014, over a decade old, where they injected salmon PDRN intramuscularly, as well as applied it to diabetic ulcers. So the patients were injected with PDRN, and you can see there the dose, 5 milligrams in a 3 ml vial, 5 days a week. And there also was applied topically on the lesions, and they looked at the complete healing of the ulcers, and it was twice as good in the PDRN treated diabetic ulcers. And this was randomized, double-blind, controlled trial. And you can look it up yourself if you're interested. The Journal of Clinical Endocrinology and Metabolism. So there's a lot of history, and when you go into the literature, you can see there's a lot of stuff on salmon PDRN. The actual mechanism of action of salmon PDRN has also been elucidated. There's two main pathways. One is called A2A receptor activation, and there's an adenosine receptor on the cells that the adenosine nucleoside can enter the cell. And you can see it right there in this diagram. And what happens when this is activated? We reduce inflammation. So we suppress pro-inflammatory cytokines. We boost angiogenesis. It upregulates VEGF, and it stimulates collagen as well. Now, there's a second pathway that the PDRN works as well with the actual adenine receptor. And so that's just the adenine component of the adenosine, the complete nucleotide. That receptor incorporates adenine as well as cytosine, another purine, which are of course, as you all know, are the blocks of the nucleotide. So if we take off the ribose and the phosphate group, we have adenine. And so you incorporate that into the cell. Why would the cell want to have this mechanism called the salvage pathway? Because these nucleotides are very energy intensive to make a piece of DNA. Out of the adenine and the cytosine or the guanine. And so the cell likes to recycle these items through what's called the salvage pathway, so it can make new DNA and RNA without expending so much energy, especially if it's a diseased cell, a senescent cell, or an aged cell like mine. So why not give the cell some fertilizer that it needs to make RNA and DNA? And so that's where the PDRN comes in the salvage pathway as well. So the salmon DNA is upregulating favorable pathways as well as providing a substrate in order to make more DNA and RNA, which would actually help an exosome to be made ultimately. So what are the barriers to this treatment? Well, the problem is the salmon PDRN is a very large strand of DNA. It has been estimated that you only need a maximum 500 Dalton molecule to cross the skin. Okay, but the PDRN fragments that are in salmon DNA are orders of magnitude larger than 500 Daltons, which is 0.5 kilodaltons. So the fragments of salmon DNA are anywhere from 50 to 1,500 kilodaltons, not 0.5. So they're 100 to 15,000 times larger. So how is this going to cross the skin? Well, it won't unless we somehow make some channels or disrupt the stratum corneum. And so that's where our treatments come in with application of salmon PDRN after a treatment. The other problem with salmon PDRN, if you simply apply it topically, is that it is a negatively charged molecule. The skin is also negatively charged, so it's going to repel rather than enhance transmission. Also, PDRN is hydrophilic, whereas the skin is lipophilic, so that's another problem we have. If we simply take PDRN and apply it to intact skin, it will not be able to cross the barrier very well. So, the other problem with PDRN is that there's a limited source of salmon sperm on the planet. Um, Salmon is not exactly abundant, as you know, by the price in the supermarket. It keeps going up. So how do you ethically source these salmon in order to make the salmon PDRN that is needed? So researchers have looked into this and found that we can also use vegan PDRN instead of salmon PDRN. And what are the differences between the wild caught fish and the vegan PDRN? Well, when you look into vegan PDRN, you have a much larger source because you can grow the plants or the microbes. And as it turns out, a very nice source is microbial derived PDRN from lactobacillus. LPDRN is the term that's used, the short term. And you have great control over purity and the characteristics of this DNA when it's derived from a microbe. So vegan PDRN, I guess you can argue, is a much more ethical choice for those of you that are vegans and don't want to kill the little fish. Now, the other thing is there have been all kinds of bench laboratory testing on the anti-inflammatory and wound healing effects of LPDRN. Right here you can see a petri dish, a wound model, where you simply have put in salmon PDRN in order to heal that wound and LPDRN from the microbe lactobacillus. And you can see that the wound is granulated in much better with the LPDRN. So it suggests there's greater regenerative capacity using this vegan PDRN form. And not that the salmon PDRN is bad, but this one appears it might even be better. When you look at antioxidant activity, it's more than double that of salmon PDRN in various experiments. And those all can be looked up if you want to do a deep scientific dive. And the mechanism of action is similar with binding to the A2A receptor. So there's been many studies on vegan PDRN, but it does not have the same history as salmon PDRN. So the other things that you can do with the vegan PDRN is that it's a smaller fragment, which is nice because you can take smaller fragments and put them in liposomes, as you can see there on your right, in order to enhance penetration through the skin if you'd like to use PDRN on intact skin without making microchannels, for example, with fractional laser resurfacing. The other thing that one can do, they call it plasma nanosizing, where you have these small fragments of DNA from the microbe, and you can change the charge from negative to positive. And it's been estimated you get about 11 times greater skin penetration when you use a positively charged liposomal particle to cross the skin with vegan PDRN over salmon PDRN. So, what do we do now with this material, this PDRN material? Well, we've been doing microneedling with salmon PDRN for many years right now, and the Koreans have been doing it as well for over a decade, I estimate. And when you make the little channels, it's not really an issue if you have large fragments of DNA. You can get them into the skin, okay? Now, the problem is if you want to use an at-home system, you will need, in my view, to use a smaller piece of DNA, that's the vegan PDRN, in a liposome that's positively charged over the salmon DNA. So we could use salmon DNA in our office, for example, has a long history of use. It's indisputable. It's actually classified as a drug in many countries, versus the vegan PDRN serum, which we could give the patient to take home and apply on intact skin. So salmon PDRN in the clinic is the takeaway message, and vegan PDRN in home use. So Now, when you look at all the hype versus the reality, is that there's a lot of robust data, very strong evidence on the use of salmon DNA and the mechanism of action with the A2A receptor incorporation and the salvage pathway. And we've seen clinically the post-procedure benefits. And I've not seen any immunological reactions with the salmon DNA that I've used, but I've always used very good sources. And then the ultimate thing now, the new thing, is the vegan PDRN for home use. And this will increase in use because it's easier to source and it will ultimately may prove to be better than the salmon DNA, but we don't know yet which one is superior. So now let's talk about exosomes briefly. And I had a previous webinar where I talked about exosomes and where did that come from? All the hype about exosomes. Again, Kim Kardashian, bless her heart, she's been fantastic for my business. Whenever she does a post, our business skyrockets in the office. Everybody's more interested in what social media is telling them than what the doctor says. And so she had also done an exosome facial prior to the PDRN facial. And so this hit Elle magazine, for example, and that was 2 years ago. Are exosomes the next frontier in aesthetics? And will it be bigger than Botox? All kinds of people have chimed in, well-known dermatologists in Beverly Hills, as well as the president of the American Society of Plastic Surgeons. Could be bigger than Botox. Is this the holy grail in anti-aging? And so we do know for sure that exosomes help in the recovery after we inflame or injure the skin. Think about what we're doing. We're always causing micro injuries to the skin every day in our office, and exosomes certainly help in the recovery process, beyond a doubt. So, what are these little exosomes? Briefly, for those of you who don't already know this, they're just simply little vesicles used in intercellular communication. So, our cells make exosomes and they send them out and they talk to other cells. And what is in this exosome? It's basically an envelope that's containing a package that has a messenger in it. And this package has growth factors as well as messenger RNA and various other peptides and enzymes. To give you an idea how small these things are, an exosome is classed as a extracellular vesicle that's anywhere from 35 to 150 nanometers in size. And they were discovered, oh God, almost half a century ago by Trams et al. In the knee joint cartilage. And, they have been studied ever since. So there's a lot of history on exosomes. And lately, because of the use in aesthetic applications as well as regenerative medicine, it has exploded. So you can see there the size of a virus compared to an exosome, very tiny little package containing messenger RNA and various peptides. And so just think of them as extracellular um, packages that give messages to other cells. Now, the reason the regulatory authorities are okay with exosomes compared to stem cells is that the exosomes do not contain a nucleus, so they are unable to replicate themselves. They're not a living cell. And as we know, many countries have problems with stem cells, whether they're derived, from your own adipocytes um, or your bone marrow or an allograft, from an umbilical cord or an amniotic membrane. They seem to have problems with those because those stem cells are cells with a nucleus versus the exosomes those cells produce are a nuclear, simply a messenger. So where can we source exosomes? Well, we can get them from animals, any mammal. We can get them from plants, just like the PDRN. And there's also now synthetic exosomes. Man is now making exosomes. The other source is human, and here the regulatory authorities sometimes have some difficulties because how pure is the master stem cell bank, and are there any problems with those particular cells? So, in order to avoid all that, you can just simply use plant-derived exosomes. They have many advantages. They are tolerated by the immune system, just like mammalian and human. They have great penetration through skin barriers. They have high bioavailability. They're not toxic. They're easy to store. You don't have to freeze them or refrigerate them. And they're suitable for the aesthetic applications we do in our clinic every day. And you can target specific organs. So, how do they make these things? It's actually very important. The manufacturing is critical. Many people are blending their exosomes just like you make a smoothie. And this is not a very good thing to do because it does destroy many of the exosomes. It is far better to use a centrifugation method, ultracentrifugation, and take this extract and continue to refine it until you get those tiny, 100 nanometer sized exosomes out of the plant source that you're using. And this is a tedious process. It costs money, and that's why exosomes are not that cheap. And so it is important that you ask, what is the source? Is it animal, human, plant? How was it isolated, especially if it's human or mammal, because you don't want transmission of any diseases? And then how is it purified and concentrated? And is there any study on efficacy of the particular product? Because there's dozens and dozens of companies out there selling exosomes to you now, and you want to ask yourself, are these really good exosomes? One thing you can do too is ask any company that you choose to do business with, has the FDA inspected their facility and what clearances do they have? And so Induction Therapies has 5 different certifications here in their facility. They've been inspected, and so there aren't rats running around on the floor. This is the kind of thing that you want to check. So ultimately, we all want to make a living using exosomes and PDRN in our aesthetic applications. So what can we do? Well, if you look at a review here, and this is the largest one I could find, exosomes in the real world of medical aesthetics, they looked at almost 17,000 articles over the last 4 decades. And you can see the number of articles after they debugged the database on aesthetic applications has markedly increased right there. And when they looked at it, 339 articles met their aesthetic review criteria. They looked at those to see which ones were actually really, really good, and they culled it down to 9 articles, as you can see in this slide, like only one on melasma, one on skin rejuvenation. So now this is a couple years old, so actually 3 years old. So there have been more since then, and you can find them on any literature search. So how do I deliver these exosomes into the skin or scalp? Like what am I going to do? Well, I have to make channels, and the simplest way to do that is microneedling with a good microneedling pen. That is the easiest way to make little channels in the skin in order to deliver exosomes or salmon PDRN. If you don't want to do microneedling, you'd have to use a fractional laser to make the little holes. So what we want to do is make channels in the skin. And of course, when we make the channels in the skin, we've induced a microscopic injury. The skin will heal. I mean, microneedling has been around for decades, and now we have simply changed it by adding various regenerative agents to enhance the treatment and the skin rejuvenation. And we do that with lasers as well. Why I like microneedling is that you can literally use it on anything, any skin type, any gender, any condition. As you can see here from an article from Tina Alster, I mean, is there anything that's missing here that one can treat with microneedling? It's basically everything, including alopecia, hair loss as well on the scalp. Microneedling the scalp alone has helped, for instance, kids with alopecia areata, totalis. I mean, completely bald kids have been microneedled and their hair grew back. It's truly remarkable. So I would like to see microneedling made great again. And how do we do this? By adding some exosomes and PDRN to our treatment. Why not? Rather than just doing microneedling, we can do both. So you can get this hat right here, make microneedling great again. And for those of you that are offended by the red cap, it also comes in blue as well. Okay, so we've got both so that we are bipartisan here with microneedling. Now, how old is the microneedling in the United States? Well, the first microneedling pen that was FDA cleared was in 2016, 1 decade ago, and that was the skin pen. And they still have a large market share, of course, and they have 14 needles. And if you look at it with 7,200 RPMs, how many perforations are you getting? Well, you can do the math yourself. It's 1,680 perforations per second on the skin. Then along came the Dermapen, which is another large manufacturer. They also have 7,000 RPM and they have 16 needles. And so when you look at that, you get a few more perforations per second. Now, I like the collagen pen simply because it's more powerful and much faster. It was approved just 4 years ago. It has 9,000 RPM rather than 7,000, and it has 36 needles in the needle cartridge. That's the primary difference that allows it to be much faster than the other competitors that are out there. And if you do the math, you're getting 5,400 perforations per second. There's a close-up picture of a skin pen versus a collagen pin. And so you see the difference in the number of needles with faster oscillation. What does this translate? 3 times the speed. So for anyone who's using a skin pen or a derma pen, this thing is 3 times as fast. It takes you 1/3 the time to do the same treatment. If you spend the same time on someone's face using this particular pen as you do with the skin pen, you'll have 3 times the channels. I mean, if that's what you want to do, that's what's going to happen because you're making many more microperforations with this particular device. So I really like it for the speed. Very, very fast. Now, rather than using hyaluronic acid gel, which we've been doing for over a decade now with our various microneedling devices, why not use exosomes? So you could apply exosomes to the skin as your glide solution rather than just simple hyaluronic acid, which we've been doing, as I say, for years. Now, if you apply exosomes, it's a value-added treatment, and you have to explain to the patient, you're going to charge them a little more. And induction therapies makes two particular products, their PX7 and their PRX8, and they're identical plant-based exosomes. However, one of them contains retinol, the one in the blue right there, all trans retinol. So it's nice if you want to add a little bit of retinol to the treatment, you would use the PRX8. If you don't want to add any retinol, just use the PX7. You have a choice as a provider. Both of them contain the copper tripeptides. As we all know, the GHK copper is very popular right now, and everybody seems to be injecting themselves, buying this stuff from various peptide companies and actually injecting it subcutaneously to improve the skin and connective tissue. And it's all over social media. Well, that stuff is actually in here when you microneedle the skin. Now, you can also ask anybody that you choose to buy your exosomes from, have they done any third-party testing on the exosomes? How many exosomes are actually in their product? And what is the concentration per mil, for example? And here are various exosomes that have been tested by an independent laboratory in Great Britain. And you can see here, P is actually the PX7 exosomes, and compared to these other ones, they had far more exosome particles measured in the product. And so that number there, 5.3 times 10 to the 11, is 5 trillion exosomes. And that's per mil. So I guess there would be 50 trillion in the bottle then, if we have 10 mil bottles. So 5 trillion per mil in the PRX8 and the PX7. So you got plenty of exosomes from 3 plants, all made very nicely. And I've not seen any reactions to this product that I've used. Now, what we can do, and this is the whole point of this presentation now, the latest product is combining these exosomes with salmon PDRN. So they've made a product now, induction therapies, called RXO, Repair XO, and this is a mask that has the salmon PDRN with the plant-based exosomes. And you can apply this after a treatment. So rather than just using exosomes, and there's nothing wrong with doing that, you now can add PDRN with the exosomes. So this distinguishes you from other people just using the exosomes. Why not harness the power of both the exosomes and the salmon PDRN after a treatment which inflames a patient? So this is the plan in our office now, is to start using these masks after treatments that make people go red and have little holes in their face. So that's all microneedling, all fractional resurfacing, for example, any chemical peel of significance, just to cut down the redness and irritation immediately post-op. The other nice thing is that the copper tripeptides are also in this product, which is all in vogue right now, as well as a couple other products to soothe the skin. So a very nice thing that you can put on afterwards. There's also honey in there, allantoin, vitamin C, so everything that the skin needs to heal. Now, for home use, I had briefly discussed vegan PDRN, and the vegan PDRN is much smaller than the salmon PDRN. So Induction Therapies makes a product called TRUExo, their DNA repair complex, and this is the vegan PDRN in a liposomal complex in order to cross intact skin. Okay, because I don't think the salmon PDRN is going to cross anything without making little microchannels. And it also has vitamin C and ferulic acid. As we know, that's very popular in the SkinCeuticals serum, so it's also in this, along with some squalene and phospholipids in order to moisturize and repair the skin barrier, as well as vitamin E. And some other peptides as well. There's an amino acid blend in there. So you've got a nice synergistic blend of antioxidants, peptides, vegan PDRN, and ferulic acid and vitamin C to help the skin glow. So all these things are adjuncts to injectables, whether your injectable is microneedling, RF microneedling, or, for example, pinpoint microneedling right here, where I'm having an Agnes treatment under my chin, as well as having my lids done at the same time. And so what you want to ask your patients, I did not have the benefit when this was done of having any exosomes or PDRN afterwards, so I had to simply heal on my own, and that's a bit uncomfortable for the first 1, 2, and 3 days. And so since I've been using, for example, the exosomes, the healing response is fantastic. There's much less redness, less swelling, less pain, less heat if you're using a laser on the patients when you use these things. So who wouldn't want to have a quick microneedling treatment after having an injectable, for example, or a neuromodulator treatment? So after you inject Botox in a patient, you could ask them if they would like a light microneedling treatment with or without exosomes, with or without salmon PDRN. Afterwards to calm any skin irritation. So these are very quick things that your office staff can do after an injectable and certainly after any treatment. I would have liked to have a mask on my face after having this done to me. So my patient's experience with exosomes, I've shown this picture before. We have several of these now of patients that we used to just do Botox treatments on them 2 or 3 times a year. And you can see here we have a lady who has large pores, laxity under her eyes. She has no dynamic lines because she's been doing Botox for a few years, but she also lacks volume. Look at the mid-cheek groove, the nasolabial fold, the marionette zone, the mentalis crease, the temple hollowing. And then what you do is you continue their neuromodulator treatment. You add some filler, you add the skin boosters, and in this case, she also had the soft wave done and the Silfirm RF microneedling with exosomes, and you can see the improvement on the other side of her face. And she's 5 years older, but looks 5 years younger than in 2019. If we zoom in on the skin, you can see the skin quality is far superior under the eyes as well. And, I attribute all this to combination therapy, which the Koreans are doing on a routine basis right now, every day. So there's also many pictures that you can get from induction therapies as well, where people simply have had only microneedling with the plant-based exosomes with the retinol. So now you can add PDRN mask to this as well after the treatment to reduce the redness. And so we see the improvements in the skin here just simply done with microneedling is truly phenomenal, especially inflamed skin. People that have for instance, papulopustular rosacea, acne vulgaris, psoriasis, just inflamed skin in general. I find the exosomes are very nice for them. So what we've come up with now, the trifecta recipe, if you'd like to stack simple things rather than complicated treatments, is you can simply perform microneedling with the plant-based exosomes, choose the PX7 or the PRX8. So the question is, would you like to have retinol or not? Because you might have a little bit of light irritation and or peeling 3 days later if you add high-dose retinol, but you're enhancing the entire rejuvenation experience. Dermatologists have been doing retinol peels for decades. And then, in order to reduce the immediate redness, why not apply the RXO mask, which is more exosomes, and PDRN, the salmon PDRN, to soothe the skin. And it's very nice. The patient doesn't have to leave the office extremely irritated. And if they had a heat-based treatment, I would keep them in the fridge and simply put them on nice and cool on the face. And then, if they're interested, you can sell them a bottle of Youth XO to take home. And then they continue to use a product that has vitamin C, ferulic acid, squalene in it, a bunch of peptides, as well as vegan PDRN. So you can explain to them that they're getting PDRN in a liposomal complex. But if you handed them the salmon PDRN, it probably wouldn't work as well. And so these are the three products right there that you can use. The first one in the office, the second one in the office, and the third one daily at home for use. And so it's very simple. And now we can distinguish ourselves from our competitors by offering both exosomes and PDRN together or separately. So thank you very much. And I think this combination will enhance beautiful skin. And so I'll
Perfect.
open the floor to questions, and Justin will moderate those.
Yes, thank you, Dr. Braun. Thank you. And I do believe we had one attendee that worked with you 25 years ago and was just saying hey, but their question was
Wow.
was answered at the very end with combining the PX7 during treatment and then using the RXO Repair XO mask directly post to reduce that post-inflammatory
Right.
erythema.
And you don't have to do that, but you'll enhance the whole treatment experience. And I'm literally thinking now that why aren't we doing this on every single treatment where we inflame the patients for post care? And in Asia, post care is a very big part of the treatment because, as you know, Asians have exotic skin that is more susceptible to post inflammatory hyperpigmentation. And we all know the faster you heal, the less chance you're going to get PIH or any sequelae.
Yes. And another question from our audience is they'll be traveling actually over to Seoul, Korea, and they were wondering if you had any recommendations for any place to stop over there in the way of aesthetic beauty. Any
Well,
shows to
the
look out for?
Sofitel is the nicest hotel there. I got to stay in there, and you get to look at the Loche Tower, which is the highest, tallest building in Seoul. And it's actually two towers together, and you can walk between them. They chain you on this little catwalk. And to go to different clinics, there are so many. There's literally buildings and streets, like the way Seattle has Starbucks and coffee shops. You can see literally 100 clinics. I'm not exaggerating within one block. Like it's unbelievable. There's whole buildings, like a 20-story building with clinics all over the place. But the I'm generally the way you get into one of those places, you have to know somebody or be sponsored by some company. I've gone over there, for example, even with Galderma, and they'll have some doctors that are using their products, and then they'll let you go see them. So I've been fortunate enough that I've been to several different offices there, and it's just a matter of reaching out with your reps and you know anyone over there.
Right.
I'm
And then
not
we
Korean,
do have another question about using vegan PDRN with adjunct at-home microneedlings if they're just microchanneling and not so much going as deep, but using the
Right.
vegan PDRN.
Yes. I mean, of course, people have those rollers and everything. You just simply have to be careful that the patient is keeping them sterile. Because my big concern is these things are all sold on Amazon and Alibaba for anywhere from $5 to $100 a piece. I don't know why the big price discrepancies, but they're rollers, usually not stamping devices. I've tried a few of them. I've ordered them just to try them. Some are absolute garbage. They just basically rip the skin. They're not very sharp. And what I found that one can do, I tell the patients if they're using this, they should take 99% isopropyl alcohol, rubbing alcohol. If you can't find the pure stuff, just use 70% and put it in a glass with cotton batten on the bottom, a cotton pad, because you can then soak your roller in the isopropyl alcohol next to the sink all night, and that'll kill everything. And then take it out, rinse it, under tap water. I guess unless you live in Flint, Michigan, the tap water should be fine. I don't know. And then you can roll your face. And then, yes, any product will go in better with home rolling. My only concern is the quality of the home roller. And two, is it clean? That they don't give themselves an infection of some sort. That's all. But yes, the answer is yes, it would enhance the treatment because there's better penetration when you use you're basically doing home microchanneling.
Thank you, thank you. And the next one is on what are those quick sort of 3 bullet points to a provider that just kind of quickly claps back against plant exosomes and says, I only use human and they're the gold standard?
You can use human exosomes. The problem is, in many jurisdictions, they're forbidden. For example, Europe has banned human exosomes. And so you have to use plant exosomes or synthetic exosomes if you can find a good synthetic manufacturer. And so human exosomes, I suppose they are appealing, and I've used them myself. I've had numerous injections in both Taiwan and Korea in me of human exosomes as well as human allograft stem cells. I've had amniotic cells, umbilical cells, injected in me, both IV and in my knee. I've bad knees. So if there's any prions or anything in there, I guess I'm cooked, right now. So there's nothing particularly wrong with human exosomes. It's just being on side with the regulators, in
Got
your
it.
jurisdiction. And with plant, we don't have those problems.
Right, exactly. Okay, so in the next one, they're asking about really patients with psoriasis when it comes to microneedling, salmon PDRN, vegan PDRN, exosomes, retinol. Really, we've kind of added a lot of actives
Yes.
here tonight. So really, on that psoriasis, and could any of these be done to help it, or would it hinder it if there's a current breakout?
Well, the one thing I would do, I'm trying to be more holistic now, and there's all kinds of recent literature. Look at the patient. If they are overweight or obese, I would put them on a GLP-1 immediately because that's very anti-inflammatory, and there's nothing wrong with losing the weight. That seems to be the treatment for anyone who's obese with psoriasis. And then I would use these regenerative therapies, especially if they're not responding to these exotic immunologics or, topical treatments, like the conventional medicine. And there's nothing wrong with staying on those treatments and augmenting this. I have a patient that I've completely cleared up severe inflammatory rosacea. She's seen every dermatologist in town, been on every single treatment, and had every device done to her. And it's the exosomes that cleared her up. All right. And I've seen this time and time again with various things like lichen sclerosis, for example. It's fascinating how well this stuff can work.
Yes.
I mean,
And now our next question is really centered around the scalp and the hair.
mhm.
Once that oxygen loss is, the hypoxia has occurred on the scalp, really about what those desired depths are to really help give that follicle oxygenated, deliver that blood flow with these exosomes.
Yes, I struggle with that myself. Like, what is the appropriate depth? I don't think we have to go as deep as we had been going, with either whether you're going to inject, because I've done on my own hair, both my brothers are fairly bald. So I don't know if I just got lucky genetically or is it all the treatments I've done on my scalp, and including microneedling and using the exosomes on my scalp. And generally, what we do, because most men are wusses, okay, is that we don't go as deep because it hurts more and now there's more bleeding. And the other thing that I struggle with is that if you are a proponent of deep microneedling, you're going to get more bleeding. And if blood is coming out of the hole, how are you getting whatever product you'd like to get in the channel to go in? Especially if you got a bleeding scalp and now you got a bloody scalp. I like to do these procedures as not very painful, no downtime, that you can literally brush what little hair you have left. This is the bridge over troubled waters right now, and 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 not look horrible. So we generally go maximum, usually 1.5 millimeters. On the face, we'll do anywhere like zero point 0.3 to zero point 0.5. The only time we go deeper is you have deep rhytids or acne scarring or some
Mm.
traumatic scar. Then we go deeper and tell the patient, this is going to hurt more, it's going to bleed more. And we have to go deep because you have a scar. You don't just have atrophic, skin with poor oxygenation. And remember, it's been shown microneedling by itself even helps hair growth. So there is the benefit just from doing the microneedling. But I look at it, I'm now 67 years old. And so, my platelets are, now almost 7 decades old. Why wouldn't I use stuff out of a bottle rather than my own PRP? And I was
Right.
never impressed with my own PRP for hair growth. But how do you know? So I like the using exosomes over that, as well as for skin rejuvenation. I know people you will use PRP and it's a hassle. You got to take the blood. We had a woman in today who insisted on PRF, and so we had great difficulty. Took two nurses to get her blood out, and both are very good at phlebology. And I'm trying to tell her, look, why don't we just use some exosomes, and microneedle you? And she insisted on the PRF, and so well, we finally got a tube out of her. And the whole thing, I was thinking there, well, what are we doing?
And that really lays up the next question too, is comparing the regenerative properties of the PRF versus the PDRNs and the exosomes.
Well, in Europe, the movement is when I hear from my colleagues over there that the PRP is going down and things like PDRN are going up, and I don't know how much of that is driven by social media, people like Kim Kardashian doing it, and then patients coming in and asking for it. Other than the one today that was keen on, filler is now a bad word, so people are looking for these regenerative therapies. I mean, it's not fair that fillers are, being so maligned on social media. I love hyaluronic acid, and but if the patients don't want it, like that lady today, where it was so great difficulty getting her blood out. And I've never been impressed with the lifting ability or the durability of just using your own platelets, in the face. You need
Yes.
multiple treatments too.
And now the next question is really, I think, centered around microneedling and toxin and, chicken before the egg or toxin before the microneedling or after.
You can even add the Botox to the microneedling. I don't think it really matters. There was a great paper recently looking at a retrospective review of 5,000 patients. I think it was in Italy, 5,000 patients, and looking at complications after toxin. And these particular doctors simply said, look, for 10 minutes, don't rub the area, don't do this, for example, getting into the eyelid. That was the only instruction. Okay. And they had no increase in complications whatsoever in the patients that were, versus another group of patients that were told, do all this nonsense, like, don't touch it, don't lay down, don't go shoe shopping. I mean, I've heard it all. Don't go in the sauna, don't do this, don't do that. I did the most Botox in Canada, probably at one point, maybe even the most in North America. It was a huge amount of Botox I was doing back in the day till I slowed down. And I never told patients to do anything in particular. I thought it was always nonsense. Okay. And I remember once it was in Vogue magazine where a famous dermatologist from Manhattan warned that you cannot go shoe shopping, after Botox because you're bending forward. And I remember a lot of women coming in. I actually went out to buy that issue of Vogue magazine just to read it myself. Okay. And that's what she said. And I had to, it just drove me crazy. It just
I
like,
can
well,
imagine.
why didn't you tell me I couldn't go shopping after Botox? Because they read it in Vogue magazine. I've never seen a problem after Botox that I can attribute to any kind of manipulation or something that the patient did. It's always injector related.
Yes. And now our next question, and we'll do one more before moving on to our next section here to close it out, is that what do you think that plant exosomes would be more ideal for anyone suffering with any autoimmunity rather than the human
A
exosomes?
good point too. Yeah. I mean, because we don't even understand all these human autoimmune conditions. So it's certainly then not an issue, right? Doing the
Right?
plants. It's a very good point. And so, not that I think the human ones would be bad. There's very good human ones. There's very good mammalian ones. But you also want to remember, this is the gray area of medicine. Like you have to look in your own state and jurisdiction, what will happen, if you start advertising that you're, you know doing the human ones. Are they okay with it? Like I said, in the EU you can't do it, so the question is mute. You'd have to be underground doing it.
Right. Absolutely. And so that will conclude our Q&A portion, and I will drive from here on going over and really sort of looping in our trifecta, our treatment trifecta from earlier. And so here we're going to be incorporating these topicals, which let me get my little cursor going here, of the exosomes and PDRN. So when we're starting off in the treatment room, to reiterate what Dr. Braun was coming at with our topicals available, is that we have that PRX8, that topical environment of the copper tripeptides, exosomes, and the retinol to use as our environment to glide those needles across the skin. Following it up with that repair exo mask directly post. This is what the patient is really going to remember. Dr. Braun, to hammer it home, is this is what's going to increase the patient experience. They're not going to leave with that normal erythema that we're so used to seeing with microneedlings. And then following it up and taking it all the way home is to continue to get those regenerative properties of the vegan PDRN at home, since we know that the salmon is larger. It does benefit from those microchannels so that it can get deeper into its destination, whereas the vegan PDRN does not. It's smaller and it can penetrate the stratum corneum a bit more effectively. So as we're bringing in these topicals, really what you as practice owners and practitioners want to know is how much is it going to cost you? And so on a normal day, it's $115 for a vial of PRX8. You approximately only need about 3 mLs to 3.5 milliliters for the face treatment, with the residual remaining approximate 7 milliliters to be taken home for post-care. That's the reason why it does come in a 10 milliliter vial. And now following up with that $25 wholesale cost RXO mask, this is going to be what is going to reduce that post-inflammatory erythema, allow them to leave the office with little to no visible signs of treatment. And then that per unit of the vegan PDRN is a 30 ml serum in that squalene base, going to be very supple and hydrating. I like that this is a post-care suitable topical, as well as a great daily use as well, just to continue to get those regenerative properties at only $79 wholesale per unit. And of course, all MSRP service charges, which is what the patient is going to be paying, is going to be suggested 100% markup from wholesale. And so really exciting is that tonight through Friday, February 27th, we are going to be offering 8 units of these. It's going to be a set of 8 of each of these at a discounted price at only $1,000 investment for your practice, down from its regular $1,832 price tag, which is, wait for it, 45% off. It's nearly half off, so it really is a no-brainer. I'm probably speaking a lot more of your all's language now. And so really looking at your return across all of these topicals, it's just great to incorporate these, increase their treatment, reduce their downtime, maintain that skin's integrity, which really, when you're upselling these new regenerative technologies, that's really what you're doing, is that the legacy hyaluronic acids that we've been using for the last decade, they're really going to leave more of those visible signs of treatment, that erythema, the peeling, the shedding, which you're still going to peel, of course, but it's going to be very microly. So you're not going to see those long-term visible signs of downtime, which you're going to have your skin return to normal flesh tone sooner. So overall, your return on investment is going to be about $3,500 for all those topicals at just $1,000 investment. So if you would like to get to that webpage with that deal, just scan this QR code here, and also be on the lookout in your email for your freebie offer. So you will be having the opportunity to just get your shipping and get a topical of the Youth XO and the RXO. So without further ado, that is all that we have planned for you tonight. And I just want to thank you for joining us. Thank you, Dr. Braun, for an amazing presentation and for taking questions from our audience. And our next webinar, which was a question in our Q&A, will be, I believe, next month on traditional versus RF microneedling. So do tune into that one. All right, everyone. Thank you so much for your time and attention, and we'll see you next time.
Thank you. Bye-bye. Thank you.
Bye-bye.